Welcome back to the time of your life with me, Ethel Rasmussen. With fall approaching, flu season will once again be upon us. Baltimore County Department of Health and Human Services Director Dr. Lucy Wilson joins us now to inform us on the latest vaccines, as well as best practices to help prevent the spread of illness. Dr. Wilson, it is my pleasure to have you here on the Time of Your Life television show.
Thanks so much for having me. It's great to be here.
Dr. Wilson, first and foremost, could you please explain to our viewers some of the services the Baltimore County Department of Health and Human Services provides?
Baltimore County Department of Health and Human Services, our Department of Health, have a really wide range of services. So I'll go over 4 different categories of services that we offer through the Department of Health. We have behavioral and mental health services. We also have our infectious disease and mitigation services. So we do investigations of infectious diseases. We case manage exposures to infectious diseases. We deal with outbreaks. And the final group I wanted to talk about is our aging and chronic disease prevention. Especially important that in Baltimore County, 19.7% of our residents are age 65 or older. And we do work closely with the Department of Social Services and other sister agencies like the Department of Aging to help provide services for our senior population. And that includes our adult evaluation and review services to help people stay in their homes, in-home aid services, enrollment for Medicaid, as well as medical transportation services. So really a broad range of services for the whole lifespan.
Definitely. Let's shift gears. When would you say is the optimal time for older adults to get vaccinated for the 2025 flu season?
So the CDC, or the Center for Disease Control and Prevention, they classify influenza season or flu season as running from October to May. So the cases start to pick up in October. And as we all know, December and January and February are those really heavy influenza months. So we want people to get vaccinated before that so they have time to build up their immunity and make sure they don't get infected. Because it can take some time for that vaccine to take effect, maybe a few weeks, we recommend getting vaccinated in the early fall, starting in that September time period. So the Department of Health holds flu clinics at our health centers. We also have a special flu clinic. We have one scheduled on September 27th at our Drumcastle Government Center. That's the one on 6401 York Road. We're also going to have a number of mobile flu clinics in the community, and we'll have that listed on our website and on our Facebook pages.
Excellent. In addition to flu vaccine, what other vaccinations should older adults consider?
So there are a number of vaccines that adults, especially older adults age 65 and over, should consider. I like to group them into the respiratory category and the non-respiratory category. So in the respiratory category, we have the pneumococcal vaccine, that's for strep pneumonia, influenza vaccine, COVID-19 vaccine, and the RSV vaccine. So I wanted to give a little more detail on those vaccines that I just listed off like that. So the pneumococcal vaccine, again, it prevents against strep pneumonia. That's one shot, and it's recommended for people who are age 65 or older. Pneumococcal pneumonia and other pneumococcal infections are a really important cause of illness and death in people over 65. So strongly recommended, one shot. The influenza vaccine, or the flu vaccine, is a once a year shot, and so an annual shot. And just I wanted to point out that 90% of influenza deaths occur in people over 60 years of age, and that age group also has the highest level of hospitalization. So we're really trying to prevent that severe infection, hospitalization, and death, which is just more likely over at the age of 60. And then the RSV vaccine is a new vaccine that became available in 2023 for older adults.
So I heard you mention the RSV. Could you further explain to our viewers what this illness is and why it's so important to be vaccinated against it?
Yes. So RSV stands for respiratory syncytial virus, RSV, and it's a respiratory virus that can affect all ages, but it is more likely to affect people at very young ages and at older ages. So those are the people that are most likely to have those severe consequences or hospitalization or death. It usually peaks in December or January, and it in those over the age of 60, there's a higher risk if you also have other diseases like heart disease, lung disease, immune system disease. It's also more likely to affect people who are living in nursing homes and especially people aged 75 or older. So this new vaccine. It's available for people who are 60 years or older, and for those who are 60 to 74, it's recommended if you're high risk for some of those diseases, those co-occurring diseases that I just mentioned. It's recommended for everyone over age of 75. And again, like flu, it's recommended that you get that vaccine in late summer or early fall.
So, Dr. Wilson, is it safe for older adults to receive multiple vaccinations in one clinic visit?
Yeah, for all the standard adult vaccines, it's safe to receive them in the same clinic visit. There are special circumstances, but for other vaccines for people with certain conditions, but for regular adult vaccines, it's safe to get them all at the same in the same visits.
Some great points there. Where can older adults go to learn more about which vaccines they should get?
So, the Maryland Department of Health, the National Institute on Aging, and the CDC, or the Centers for Disease Control and Prevention, also all have really good links for that.
Dr. Wilson, before we part, is there any other information you would like our viewers to be aware of?
Keep up to date, follow us on social media, and also look for us. This year we'll be at the Power of Age Expo, and we'll have multiple tables actually with information on our programs. We do hearing checks, we do blood pressure checks, we do other health screenings there. You get to meet all our friendly staff who, the experts in the different areas are represented there. And we even, because we also oversee animal services for the county, we have our cuddle shuttle inside the expo, and those are multiple cats and dogs that you can consider for adoption or just cuddle with. So,
Definitely. The health department display is always outstanding at the Power of Age Expo, so we look forward to that. Thank you for taking time to join us on the show and sharing this important public health information to our viewers.
thanks so much for having me.
And that's today's show. Thank you for spending your time with us. Please remember you can call the Department of Aging's information line called Maryland Access Point of Baltimore County or MAP at 410-887-2594 with questions pertaining to older adults and persons with disabilities. This show may be viewed also anytime on the Baltimore County Government YouTube channel at youtube.com/baltcogov with open captioning us. That brings us to the conclusion of this edition of The Time of Your Life, a National Mature Media Award winner, about the services and contemporary topics that keep you in the know. Until next time.